Hello everyone, I'm Dr. Ahmadzade from the Academy of Online Radiology Education and a research fellow in the Department of Radiology at Baylor College of Medicine. Today, I'll be presenting a study entitled Renal Function After CT-Guided Cryoablation of Small Renal Tumors in Patients with Solitary Kidney based on data from the European EuRECA registry. Renal cell carcinoma affects roughly 400,000 patients worldwide each year and carries significant mortality. Nephron-sparing surgery such as partial nephrectomy is the standard for T1 tumors but poses a risk of permanent parenchymal loss in solitary kidney patients. In 2022, the AUA recommended considering ablative therapies for T1A lesions under 3 cm. However, the quantitative impact of cryoablation on renal function in this high-risk group remain under-characterized. This analysis draws on the European Registry for Renal Cryoablation, EuRECA, a prospective multinational cohort spanning 16 centers in 7 European countries from 2014 to 2020. Inclusion criteria were adult patient with a solitary kidney and a single biopsy-confirmed RCC, 1 CT-guided percutaneous cryoablation session, and both baseline and 3 months post-procedure EGFR measurements. And exclusion criteria included multiple tumors, repeat cryoablation procedures, or any prior intervention on the solitary kidney. Among 70 eligible patients, mean baseline EGFR was 55.8, which declined to 49.6 at 3 months, a statistically significant drop of 6.2 or 11%. Crucially, no patient progressed to end-stage chronic kidney disease, demonstrating that controlled ice ball formation can ablate the tumor while sparing enough healthy parenchyma. Pickers, Gill, and colleagues previously reported an 11% EGFR decline after cryoablation in patients with 2 kidneys, mirroring the current study's findings. Bindi's propensity match comparison also showed an 11 to 12% reduction after cryoablation versus partial nephrectomy, with no significant difference in functional outcomes. Together, these studies reinforce that image-guided cryoablation can achieve nephron preservation on par with surgery in patients at high risk for renal insufficiency. However, several limitations temper this conclusion. In this study, only 38% of registry entries had complete 3 months follow-up, introducing potential selection bias. Also, the single-arm non-randomized design prevents direct comparison with surgical controls. Most tumors were small and exophatic, limiting generalization to larger or centrally located lesions. Clinically, cryoablation can be considered as a nephron-sparing option for solitary kidney RCC, especially in patients unfit for surgery. Treatment choice must be individualized through multidisciplinary discussion balancing tumor anatomy, comorbidity, and renal reserve. Future work should include randomized trials comparing cryoablation and partial nephrectomy on long-term renal and oncologic outcomes, as well as studies of quality of life and cost-effectiveness. Optimizing post-ablation surveillance beyond 3 months will also be critical. Thanks for watching. Follow ACORE for more updates in interventional oncology research.